Come in.
Hi there, my name's Maureen.
Hi.
I'm going to be your nurse today. Let me perform some hand hygiene. Okay, how would you like to be addressed today?
Matt is fine.
Okay, and Matt, could you tell me your name and date of birth?
Matthew Raw, 2777.
Okay, great. And can you tell me how you got here today?
Sure. My electrician drove me over about 20 minutes ago.
Okay, and do you know where you are right now?
Yes, San Marcos Hospital.
Okay, and do you know what you had for dinner last night?
I've actually been fasting, so I didn't have dinner last night.
Oh, okay, that's impressive. Okay, so patient is alert and oriented ×4. He is alert to place, time, and person. So today, we just want to do a thorough head-to-toe assessment. This is just a check of overall your body, just to kind of make sure that things are healthy and that you're feeling good, and it shouldn't take too long and it shouldn't be painful. Is that okay with you today?
Sure.
Okay, and before we begin, with 0 being no pain at all and 10 being extreme pain, are you having any pain today?
No.
So what would you rate your
0.
pain? A 0. Okay, great. So patient reports 0 pain. Patient's mood matches his affect. He's well groomed, well nourished. Remote and short-term memory are intact, and so we're going to get started. So let's start with the head. So first I'm just going to inspect. I'm going to look for any lesions or any abnormal marks on the head, and then I'm going to palpate the head. Is that tender?
No.
Okay. There are no lumps or lesions detected. There's no signs of infestation. The hair is soft and appropriately distributed for age. So we're going to come down to your face. So first I'm just going to inspect your face. Would you mind removing your glasses for this part of the exam? Thank you. Oh, and I forgot to mention that before we started this exam, we tested you on the Snellen eye chart, and you were 20/20 with your glasses in both eyes. And we also got your height and weight and vitals, and so we did all of that before beginning today. So I'm going to start just by palpating your facial bones. So please let me know if there's any tenderness. Is that okay? Okay. There's no pain on palpation of the facial bones. I'm also going to palpate your sinuses, your maxillary. Any pain on your sinuses?
No.
No? Okay. I'm also going to palpate your TMJ joint. So could you just open slowly and close? Thank you. No signs of crepitus or pops or clicks for the temporomandibular joint. So that's good news. Okay, so let's start with your eyes. Going to just visually inspect your eyes. They are symmetrical. There's no redness. They're clear. Do you mind holding below your eyes like this and looking up? Okay. So I notice the conjunctiva is pink and moist, and the sclera is white with no blood vessels or lesions present, which is excellent. Okay, first I'm going to check for your pupillary light response. So I'm gonna kind of pretend I dimmed the lights in the room, but I'll just use my hand. And I'm going to use my pen light and just look straight ahead. And I would shine it into this side first, and then into your other eye. So pupillary light response, both pupils constricted consensually, so that was good. And that helped test cranial nerves 2 and 3, which also will do the corneal light reflex, which also tests those cranial nerves. So I'll shine at the bridge of your nose. Okay, and I notice no signs of strabismus, no redness in the cornea. And that's looking great. And we'll also do your peripheral vision test. So do you mind putting your right hand over your right eye? Okay, and I'll put the opposite hand over my eye. And let me know when you can see my finger. Okay, yeah. Okay, and then switch. So we'll do this, and let me know when you can see my finger.
Yep.
Okay, so that also tests cranial nerves 2 and 3. I know that that's intact. Now I'd like you to look at my pen. And can you follow it with just your eyes, not your head? Okay, great. And then can you look at it as it comes in and out? Okay, so patient's eyes move freely. There's no signs of fasciculations. He's also able to accommodate near and far. So that tests cranial nerves 3, 4, and 6. So those nerves are all intact, which is great. Okay, so we're going to move down to the nose. First, I'm just going to inspect the nose. There's no signs of any lesions or lumps. I'm going to palpate the nose. Is any of this tender?
No.
Okay, and then do you mind looking up for me? I'm going to shine my light into the nose, and I notice that the septum is midline, turbinates are free, mucus is thin. Okay, can you put your head back down and then block one nostril and breathe in? Okay, and then the other. Okay, the airway is patent. If we wanted to test his cranial nerve 1, we might have different scents that he could smell and let us know what he was smelling, and then we would know that cranial nerve was also intact. So we're going to move down to your mouth. I'm going to inspect your mouth. There's no signs of cyanosis. Lips are pink and moist. Do you mind opening your mouth? Just on inspection, I see that the mucus is appropriate. The buccal mucosa is pink. There's no signs of any dental caries. The gum line doesn't look reddened or irritated. Can you stick your tongue out and say, ah? Okay, upon saying ah, the uvula elevated, the palate elevated, the tonsils are in the appropriate spot. They're not touching each other, or nothing looks red or irritated. And can you stick out your tongue for me? And can you move it to the left and to the right and up and down? Okay, and that shows me the cranial nerves 9, 10, and 12 are all functioning appropriately. So that's great. Okay, we're going to move on to your ears. So first I'm just going to inspect. No signs of drainage, no signs of any abnormalities on the ears. I would palpate your auricles and your pinna. I don't feel anything there. Okay, and then I would take my light and just look in. I don't see any cerumen impaction or any redness. I would check the other, and I don't see any, his tympanic membrane looks the appropriate color and doesn't look infected. Do you mind putting your finger in your ear and shaking it? We're going to perform the whisper test, and this will test cranial nerve 8.
I like cheese.
Okay, let's try the other side.
I like cookies.
Okay, so it's appropriate responses on the whisper test. Cranial nerve 8 is intact. Okay, so moving on, I would come down to look at the neck. And when I look at the neck, I would just be looking for symmetry, any lesions and anything on the skin. And then I would just be looking for some motion, how his neck moves, range of motion. So do you mind looking up, looking down, looking up again? Hold on, come back to center and now look up against resistance and looking down. Okay, so his full range of motion in his neck. Okay, now can you mind looking up for me one more time? So I'm looking at his trachea. His trachea is midline, no signs of any deviation. Can you please swallow? And then can you take a deep breath? Okay, there's no signs of tracheal tugging. The thyroid is in the correct location. If I really wanted to check his thyroid, I could go from behind and palpate the thyroid. But everything looks appropriate there. I'm also going to now palpate his lymph nodes to see if I find any swelling. So I would start with preauricular, postauricular, submandible, submental. We would do tonsillar. Okay, and then I would do his anterior cervical, superior cervical, and deep cervical, and then the supraclavicular. Are you experiencing any tenderness in those areas?
No.
No. So lymph nodes are non-palpable. Patient's not reporting any tenderness. So that's great. Do you mind shrugging your shoulders up for me and putting them down, and then doing it against resistance and down? So this shows me that cranial nerve 11 is intact and functioning. Let's check some range of motion on your neck. Can you turn to the right? Okay, can you turn to the left? Okay, can you turn to the right again against my resistance? Good, and to the left against my resistance. Okay, so neck is showing full range of motion when he did the hyperextend and before against resistance, and then right and left. So neck has full range of motion. which is excellent. Okay, and then I'm going to palpate his carotid arteries. So I'm going to palpate first. Great. Okay. That one was 2+. This one is also 2+, so 2+ bilaterally on his carotid arteries. Now we're going to auscultate the carotid arteries. Okay, you're going to feel my stethoscope for a second. Okay. Okay, there's no signs of turbulent blood flow. No bruits detected upon auscultation. So we are going to move on from your neck, and we're going to move down to your upper extremities. Oh, actually, before I do that, let's test a little bit of your sensory perception. Could you close your eyes for me? And let me know when you feel my cotton swab.
Yep.
Okay, and that tests trigeminal nerve 5. That he could tell when that cotton swab was on his face. And then I'm going to do sharp and dull with my stick. So let me know if you feel a sharp sensation or dull.
Sharp, dull, sharp, sharp.
That also shows me that cranial nerve 5 is intact and functioning. We're going to do the same thing on your extremities, but first let's just do an inspection of your extremities. Muscle mass is appropriate. Let me see your hands. We're going to check for capillary refill. Okay, is less than 3 seconds in every finger. Okay, and his hands are, everything's symmetrical, muscle mass looks good. Okay, I'm going to actually check for your radial pulse. Excellent. Yep. And your brachial pulse. Okay, and I would do that on both sides. Radial pulse, brachial pulse. And they are 2+ bilaterally. And then we'll check some range of motion on your arms. So could you put your arms up like this and back down? Could you do it against my resistance? Okay, and back down against my resistance. Okay, and then can you do a bicep curl? Out and in. Okay, and then try to go out against my resistance. Okay, and then try to go in against my resistance. Excellent. Can you put your wrists out, your hands out like this? And put your wrists down and back up. Okay, and then try again, put them down against my resistance and back up. Great, and then can you make a fist? And put your fingers out. Make a fist and try to put your fingers out against my resistance. Good, so he's showing full range of motion in all extension activities. And everything, yeah, we did your part. Okay, and then let's, can you close your eyes for me? And we're just gonna test your proprioception on the upper extremities. So let me know when you feel.
Mm-hmm. Yep.
Okay, and then let me know when you feel sharp or dull.
Dull, sharp.
Okay, so his proprioception is intact with his upper extremities as well. So now I'm going to go around to the back. Do you think for this next part of the exam, would you mind removing your shirt for me, just to make it easier to hear lung sounds and heart sounds as we move on in the exam? So I'm going to go around to his back, which, can you just go make it to the edge? It'll be easy. You have to be sitting to show. So in a real exam room, I'd be able to do this better, but I'm just going to inspect his spine and notice that it's straight, no deviations, no curves that I can tell yet. I would palpate his spine to see if I felt any lumps or pain. Do you experience any tenderness upon palpation? No. Okay. And then I would check for thoracic expansion. So I would go into his back, and can you just take a deep breath? Okay. Thoracic expansion between 3 to 5 centimeters was appropriate. I would then auscultate lung sounds on the back. So I would auscultate lung sounds in 9 different spots. When you feel my stethoscope, could you please just take a deep breath? Okay, I would auscultate in 9 different locations along his back. There are no adventitious breath sounds. The breathing is clear and unlabored. No sounds of any wheezes, or pleural rubs, or any sounds that would be alarming. And now I'll come back to the front. Can you sit? Yeah, come back to the front, and I would listen to the breath sounds on the front as well. So same thing, when you feel my stethoscope, can you please just take a big deep breath in? Okay, I would auscultate both lungs bilaterally, making sure to hit the middle and lower lobes. And upon auscultation, lungs sounded clear. There were no sounds of any wheezes, bronchi, stridor, no adventitious sounds at all. So can you do me a favor and lie down? So I would make sure to be on my patient's right side, and we're going to do a cardiac evaluation. So I would first just inspect and notice that skin looks appropriate, everything looks fine, and I would first palpate for the precordium. So in the X, I would just palpate, make sure. Are you experiencing any pain?
No.
Okay, so non-tenderness to palpation on the precordium, and then I would want to listen at the aortic, pulmonic, Erb's point, tricuspid, and mitral sounds of the heart. So I will do that now. So I would auscultate those sounds. I would use my diaphragm, and then I can also then go back and also use my bell. So aortic, pulmonic, Erb's point, tricuspid, and mitral. I would also want to find the PMI, which I can find mid-clavicular line, fifth below the fifth intercostal space. If I had difficulty finding that, I could lay my patient onto his left side and then attempt again to find the PMI, but I was able to find it, so I'd make sure to find the PMI. I would then move on to the abdomen. I would first just do an inspection, look at the shape, look for any signs of diaphoresis or any signs of visible peristaltic waves. No sign of any peristalsis, so I would then auscultate the abdominal quadrant. So I would start in the right lower quadrant. And I want to hear bowel sounds in all four quadrants. Then I would go to the right upper quadrant, the left upper quadrant, and the left lower quadrant. So bowel sounds were auscultated in all four quadrants, which is what we want to hear. We want to listen for up to a minute in each quadrant if we are unable to hear any sounds. So while you're here, I just think this position might be easier. I just want to check your lower extremities. So can you, first I'm gonna, can you just scoot down a little bit just so that we don't go off camera here? A little more, thanks. So I would first check for your pulses. So I would first look for your dorsus pedalis pulse in the top of your foot. Okay. And then I would find your interior tibial pulse in your ankle. There it is. And then I would also find your popliteal pulse behind your knee. And I would do that on both sides, popliteal, tibial, and dorsal pedalis. And pulses were 2+ bilaterally on the lower extremities. And then I would want to check for some range of motion on the lower extremities. So can you do me a favor and bend your knee? Okay. And then can you bring it back down? Okay, can you try to bring it back up in that same position against my resistance? Okay, and then can you bring it back down against my resistance? Okay, and then can you put your knee back up? And then can you extend your leg straight from this position? And then back down to bent? And then can you extend it again against my resistance? And back down. Okay, great. So full range of motion in the knee and the hip. I would also ask you now for if we could, I don't know if you can see your foot, can you scoot down just a little bit more? I would ask you to flex your foot kind of like you're pushing down on a gas pedal, and then bring it back up. And then I would ask you to do that against resistance. Push down, back up. Okay, and then can you clench your toes together tightly and unclench them? Okay, and then clench them together one more time and try to unclench them against my resistance. Okay, so we have full range of motion in the ankles and in the toes. So that's great. Okay, do you mind coming to a sitting position one more time? Okay, as the patient sits up, I notice his abdominal muscles. He's able to sit up easily without pain. Are you experiencing any pain or tenderness right now?
No.
Okay, so right now we're just going to check some of your reflexes. So can you keep your hands on your lap and flip them up back and forth? And then can you do it faster? And faster? Okay, that shows me that his gross motor reflexes are intact. And then can you take out your hands like this and touch every finger to your thumb? And then do it faster and faster. Okay, that shows me that his fine motor reflexes are intact. And then can you bring your arms out to the side and close your eyes and touch your nose with your index finger. One hand at a time. Then the next one. And then can you go faster and faster? Okay, patient's sense of proprioception is intact. He's able to perform that activity. I would also in this position check for his patellar reflex. So if I didn't have my handy tool, which I don't right now, I would just use the side of my hand. So we're a little bit high up here, but I would hit in this little space below the knee. Okay, reflex intact. Okay, so his patellar reflexes are intact bilaterally. And then I would also, something I would also do is to check his ability to, his senses on his lower extremities as well. So can you close your eyes and let me know when you feel my cotton?
Yep.
Okay, and then sharp and dull as well. Ready?
Dull, sharp.
Okay, so I would make sure that those are intact as well. Okay, and then can you close your eyes for me? I'm going to perform a stereogenesis test where I'm just going to give him something in his hand, a common object, and ask him what it is. So can you open your hand for me?
Pen.
Excellent. So he passed that test, which is great. Okay, so we've done your fine motor, your gross motor, your reflexes, and your stereogenesis. So do you mind standing up for me now? We have to make sure we stay on camera. Okay. So I noticed as the patient stood, his musculature worked well. He was able to stand up without swaying or falling over. Do you mind closing your eyes for me? Okay, a slight sway is expected in the Romberg test, but he was able to keep his balance. Therefore, I know that his balance is appropriate for his age. And then if you could turn and face this way, but try to stay on camera. And I would ask the patient to take 6 steps, maybe for video purposes, just a few baby steps. 6 steps across the room and then turn back and take 6 steps back. Okay, and I would be watching his gait and recognizing if his gait was appropriate or not. Now can you do the same thing but heel to toe across the room? And turn and do the same thing, heel to toe. Okay, patient is able to keep his balance. Now could you do me a favor and bend down and touch your toes? When patient bends over, I would notice the spine. I would look for signs of lordosis or kyphosis or scoliosis, but his spine is normal curvature. I don't notice any of those things. Okay, you stand back up. And now we're going to try a little bit of range of motion in your back. So can you hyperextend your back for me? Stretch back and then go forward. Okay, can you try and hyperextend your back against resistance? Okay, and forward. Okay, and then can you twist from side to side? Okay, and then can you put one arm up overhead and lean in the opposite direction? Okay, and can you do that on the other side? Okay, so full range of motion in your back. Did you experience any pain or any sensations, unpleasant sensations there? Okay, so we've checked. Okay, you can sit back down. And let's just think, we've checked all of your cranial nerves. We've checked your shoulders, we checked your abdomen, we checked your lower extremities. Do you have any questions about what was done today?
Nope.
Okay, do you have any concerns?
Nope.
Okay, thank you. And I will let the doctor know what we discovered today. Everything looked great. There was nothing alarming, and I will, the doctor will be in soon to talk to you about next steps.
Thank you.
Thank you.